On the show, Monica ma'am. It's a pleasure to have you. We don't normally hear sleep doctors, but I'm sure the kind of lifestyle जो सारे खिलाड़ी आजकल जिनकी है उनके लिए बहुत ही जरूरी एलिमेंट बन गया है. सो फर्स्टली डॉक्टर, आई वुड लाइक टू नो अ बिट अबाउट यू कि आपने मतलब why focus on sleep? What made you pursue this?
Hi, Kavita. Thank you for having me today. Yes, what made me fall in love with sleep? So I think this all began in 2006 when I was practicing at Sir Gangaram Hospital, and I noticed how debilitating it was for my patients who were suffering, with any kind of sleep distress. And at that point, we didn't have any clear-cut clinical pathways, in terms of sleep intervention and treatments. And that is what got me interested in having a specialized training in the field of behavioral sleep medicine. And I went to University of Pennsylvania, where I did my postdoctoral training in behavioral sleep medicine. And since then, there has been no looking back.
Dr. Monica, of course, you work with Team India. You worked during the Olympics, and you meet different players, different athletes. तो जब आप इनसे मिलती हैं तो एक कॉमन प्रॉब्लम सारे खिलाड़ियों में क्या है? किस कंप्लेंट्स के साथ मोस्टली वो आपके पास आते
Taruka, it is very interesting. See, ignorance about sleep is quite profound in our country, right? Just to put things in context, we spend approximately one third of our lives sleeping. And given the average life expectancy, which falls between 73 to 79 years, I'll do the math for you. We can expect to spend approximately 25 years of our lives sleeping. So, why do we devote so much of time to sleeping? Is it absolutely essential that we sleep so much? To help you understand and answer this question, Taruka, I'll just remind you the long number of hours that a newborn baby sleeps for. It sleeps for about 16 to 18 hours a day, right? And one of the primary reasons babies sleep so much is the sheer amount of growth and development that occurs. So that in itself tells us the critical role of sleep, right, from an evolutionary standpoint. So, from say, starting from the growth hormone secretion that is significantly higher during sleep, this hormone is particularly responsible for helping babies and also young athletes grow, not just in size, but also in terms of muscle development and the maturation of their organs and systems. Also, new neural connections. So, in terms of brain development, in terms of brain optimization, memories are being formed, and sleep really helps in consolidating these memories and the processes. The kind of information that we are exposed to during the daytime. Sleep is the time where brain is necessarily solidifying all those memories and putting things into perspective. When I translate all of this science to athletes, so from the recovery standpoint, sleep is an essential component for athlete preparation. And this is the single best recovery strategy which is known to humankind. So, this is the time in a 24-hour period when our bodies and our brains heal, right? So, just to give you a little bit of science behind it, we go through different stages of sleep and also different sleep cycles. There is light sleep, there is deep sleep. And deep sleep, particularly, it helps repair muscles and bones through the process of various sleep mechanisms, right? Including release of human growth hormone that I just mentioned, which is a protein produced in the pineal gland, and also a variety of anti-inflammatory processes, agents are at work. So deep sleep, if we look at from the physical restoration standpoint, it plays an absolutely critical role in muscle development and tissue repair as well as metabolism, and absolutely vital for our physical restoration, for our physical health. And sleep is essentially that time when our body's capacity, I would say, for self repair, for self healing, is at its peak. And be that following an intense sporting event or recovering from a sport related injury, It not just affects our energy levels and concentration. We can all tell that from our experience, how we feel after pulling an all-nighter. Good sleep, not just from this physical standpoint, but also from cognitive standpoint. It helps us with getting rid of that brain fog that we experience after sleep deprivation, after, say, a long travel. It helps us with mental focus and clarity, which are absolutely essential to maintain peak performance on the field or court. Now, that is all the magical and good things and the power of sleep. But what happens when we are not sleeping adequately, which is very, very commonly seen in our high performers, in our athletes, right? So, on the other hand, when athletes or high performers, for whatever reasons, are unable to meet their sleep needs, okay? So reasons, a lot of coaches and parents will tell me कि नींद कैसे पूरी होगी जब रात को आप अपने गैजेट्स के साथ hooked हैं, you like to have that me time in front of your gadgets. आप वीडियो गेम खेल रहे हैं या सोशल मीडिया पे बहुत एक्टिव है, उसके चलते जो है बहुत सारे पेरेंट्स और कोचेस मुझे रिपोर्ट करते हैं कि दैट इज द रीजन फॉर बेड टाइम प्रोक्रास्टिनेशन. देयर इज आल्सो समथिंग कॉल्ड FOMO, which is fear of missing out, which because of which a lot of young adults, athletes as well as non-athletes, are very active during night time on their social media platforms, right? So when they are sleepless, but I'll also say, Taruka, that sometimes they also have legitimate reasons that they're unable to sleep on time and meet their sleep needs. Especially if we look at their training schedules, if we look at their competition schedules, if we talk about their travel schedules, right? So sometimes they also have legitimate reasons that they are unable to prioritize sleep for them. But for whatever be the reason, if they're unable to meet their sleep needs on a regular basis, one of the most notable effects that I see in my athletes is not just fatigue, but also decreased reaction time and physical coordination, which is especially problematic for athletes who require quick movements and precise timing. So sleep is absolutely critical when it comes to peak performance, when it comes to enhancing their recovery. And we have a lot of studies, and the amount of data we have is unbelievable now. Something that I can tell you from a clinical experience also, that when they are sleep deprived, it leads to decrease in their mental alertness, which makes it all the very difficult for players to stay focused during their games or practices, especially if we talk about mid-season fatigue, right? That seeps in. And of course, the more time they are spending in their competitions or because of travel, it leads to poor quality of sleep, not just the lesser duration of sleep, commonly again, which is seen and reported. And that further leads to increased fatigue and reduced motivation, which is causing athletes' performance to suffer even further.
To just interrupt here, if you can just give us like an example of any athlete you've been dealing with and what problem they came to you with and how you resolved it.
So, Tarika, without taking any names here, see, typically, as I said, that the ignorance is so high. So it's not very often that we will have athletes approaching us with a sleep problem. Yeah, they do realize that something is missing, something is not right. They do not wake up feeling that refreshed, or that they are experiencing a lot of daytime sleepiness, because of which, getting out for, say, their evening session, getting out of bed for their evening session is a challenge for them. But it is mostly, Taruka, when I'm talking to them, when I'm having such conversations like I'm having with you, I help them understand the red flags, right? When I help them understand their relationship with sleep, then they're able to self-assess and see if these signs and symptoms and red flags are applicable to them or not. So it is not so much about they approaching me with their sleep problem. The problem is there, but they are not able to identify it so much at their end. Maybe they think that this is fatigue. Maybe they think this is normal tiredness. Maybe they think this is normal part and parcel of, high performing lifestyle that they have. So they are not able to identify it as a problem that needs active intervention from a specialist. But educating them, creating awareness, helping them understand that these are the signs and symptoms of an underlying sleep problem or sleep deprivation or under recovery or overtraining versus how a good restorative sleep looks and feels like is what actually strikes the chord with them, or वो understand help करता है उनको understand करने में when they look within and they try to find out these signs and symptoms, that is it applicable to them or not. That is the point, turning point, I would say, when they like to have this conversation with me.
Doctor, in most cases, obviously, because you interact with a lot of athletes, what have been these common red flags among athletes which, because of which they're not able to sleep properly, or maybe they don't have a proper, consistent sleep cycle?
So, mostly what I see is number one, difficulty waking up in the morning, right? So, one of the strong, I would say, indicators of under recovery is how much you have to hit the snooze button first thing in the morning when alarm goes, right? Also, how alert you feel within first 30 hours of 30 minutes of waking up. I'll just repeat that. So some red flags, Taruka, that I help my athletes understand is one, how they feel first thing in the morning after waking up, right? So typically I ask them, how alert do they feel within first 30 minutes of waking up? And how difficult or how challenging it is for them to wake up in the morning? Are they dependent on alarms? How many times are they hitting their snooze button? And how are they feeling during the daytime? Do they feel some kind of impairment? That impairment can be cognitive impairment, that can be some physical pains and aches, and how much they are able to maintain their energy level and their alertness throughout the day. So most of them will say we feel very sleepy and we need hum bina nap liye we cannot show up for our evening training session. So these are some of the red flags that typically I get to see in athletes who are not sleeping adequately, who are not sleeping deep enough, and maybe they have an underlying undiagnosed, untreated sleep condition as well.
Dr. Monica, what suggestions would you have for athletes who actually want to, deep sleep? Because, sometimes I've been an athlete myself, and it's a difficult cycle because, you're working out, you're training, you get exhausted, but sometimes, there are other things happening as well, peripheral things that affect you. So, what would be your advice, a suggestion as to how one can attain the good deep sleep, which is essential?
So, see, first thing first, we need to understand why sleep is important. Because till the time you don't really understand why, right, it is very difficult to implement those strategies and be effective when it comes to how, right? So, it really starts with educating and creating awareness about this, right? Understanding the importance of sleep, not just in terms of recovery, in terms of peak performance, but also how sleep is absolutely non-negotiable when it comes to your general health and well-being as well. So first is understanding why sleep is important. Secondly, we need to prioritize sleep, right? Of course, there are a lot of other things going on in an athlete's life apart from their technical training, their tactical training. So there are so many other things in terms of maybe media commitments that they have, maybe family commitments that they have, etc. So as I mentioned, that sometimes they do have legitimate reasons, why they can't really block or have that sleep window for themselves. But on regular, normal training days, first thing first is that they need to prioritize sleep and they need to reserve at least 7 to 9 hours of sleep on a regular basis, right? And so it is not just about the duration of sleep, but it is also about how deep they are sleeping. So quality as well as quantity of sleep are equally important. And third point that I would like to highlight here is also sleep regularity. So, how consistently they are sleeping. So, the bedtime and the wake up time needs to be consistent. So, these are three important aspects, or I would say that's a good way to look at your sleep in terms of how proper, how healthy, or how good your sleep is. So, sleep quality, sleep duration, as well as consistency or regularity in terms of your bedtime and wake up time are three things to start with.
But how can you achieve these things? What are the ideal things one should be doing to achieve these three parameters of great sleep?
So, see, when it comes to high performance, right, it's very, very different from what we generally do with our clinical population. It is more focused on recovery. It's not just rest that we're looking at through the medium of sleep, but it is very much recovery oriented, right? So, apart from these three things that I mentioned, there are a lot of other things that we need to do in terms of maintaining their sleep cycles. We look at their sleep patterns, we monitor their sleep. Typically, I would observe, I'll study their brain waves while they're asleep. So, this is very scientific and this is very evidence based, right? And depending on the data, we get to see the staging of sleep. We also see the quality of sleep. And depending on where an athlete lies on the spectrum of sleep health, right? When I say that, is it that an athlete is sleeping adequately, but the quality of sleep is not adequate? The interventions and the approach will be different. Is it that athlete is unable to sleep for, say, X number of hours, right? Because of some constraint? Is it because of an underlying sleep disorder or a sleep condition? Then, of course, we will have a different approach and we'll have a different strategies to work on. So, really understanding and meeting them in their journey where they are on a spectrum of sleep health really decides the further course of action when it comes to intervention and treatment modalities.
Dr. Monica, what I want to know is what are the three things which athletes can do to get better sleep? I mean, what apart from, going at the same time to bed, etc., maybe what other things can help? Maybe like meditation or maybe keeping calm, deep breathing. What are these things which, athletes can do to achieve great sleep?
Okay. So apart from these three important parameters that I just discussed in terms of prioritizing your sleep, the duration of sleep, the quality of sleep, and regularity actually is very, very important, which is going to bed at the same time and also waking up at the same time. Apart from that, something as simple as digital detox, which is disengaging from any kind of stimulating activity on electronic gadget, can also be a game changer. And I've seen that. And it is not so much about the blue light which these screens are emitting, which leads to suppression of melatonin and also delay in sleep, but it is also about the content that they are watching. So disengaging with any kind of technology can really be a game changer that I have seen. And what to do in that half an hour, maybe 45 minutes that you're disengaging. So this is a good way to unwind, to really calm the nerves down, right? So, something as simple as some very gentle stretches. This can be some yoga asanas, this can be some simple breathing exercises, or this can also be a very simple, straight self care ritual. So, a lot of athletes will tell me, if I talk about female athletes, they say that, okay, ma'am, we can think of getting into some skincare regime, or maybe something as simple as applying oil, to your hair, or aromatherapy and music, maybe om chanting. So these are some other, ways to sort of calm down your nerves and set the stage for sleep, because for that you need to have a very relaxed, not just mind but also body. So these are some of very simple ways to prioritize and also set the stage for sleep.
Dr. Monica, you mentioned about seeing brain waves, evaluating brain waves of athletes. So if you can just walk me through in very layman's term about the scientific procedure which you do, or not experiment, I would say, but if you see the sleep pattern or you evaluate an athlete, how do you do about it? So I just heard you said about the brain waves. Apart from that, What other things do you do to sort of monitor an athlete's sleep?
Yeah, so this is a very comprehensive assessment. As I mentioned, this is all science-based and evidence-based. So we typically I'll get the baseline testing done and we'll understand not just their sleep cycles and also the sleep staging, right? So as I mentioned earlier, that there are different stages of sleep. N1, N2, N3, and also REM sleep, which is rapid eye movement sleep or dream sleep. And that really helps us to understand sleep from a very scientific perspective. And that also helps us to understand, are there any underlying conditions that need to be looked into and addressed? So as I mentioned, that are we looking at sleep optimization, or we are looking at sleep normalization, or do we have any underlying sleep condition that needs to be resolved first and then later on get to the sleep optimization part? So when we talk about recovery, brain waves will very beautifully give us that panoramic view of what's going on inside of our brain when we are asleep. But I'm also equally interested in looking at their ECG and various other physiological parameters, because heart rate variability is another very important factor which tells us significantly about the recovery that is taking place while they're asleep, and also their respiration in terms of their breathing while they're asleep. So it's a very in-depth analysis, and there are about 6 8 physiological parameters that we study.